Okay, Dr. Silber, I have two-part question right here. The first part is, I have PCOS, I'm 45. I've had 30 eggs, of which 18 were good, 7 embryos, but was told they were not good genetically. And then she also asks, what is the best way to achieve pregnancy?
Well, it's again with 45-year-old, it's very, very challenging eggs because the baby rate per egg is always going to be low. And with PCOS, though, she was born with such an excess of eggs because that's the cause of PCOS that she has more eggs than most women, in their 20s are going to have. And she had that. And they thought, I guess, from what I'm reading, her question, that 18 of the eggs were mature and 7 embryos resulted. But when they did a biopsy and tested them for counting chromosomes, they all had abnormal numbers of chromosomes. So it was predicted that they, wouldn't result in a pregnancy. But let me point out 30 eggs, of which 18 were good. That's crazy. With minimal stimulation, you might get 12 eggs, and they're all gems and they're all good. And then you're more likely to get embryos that will result in a baby. But it's a challenge for 45-year-old eggs. But I would do several cycles until we finally find one that is genetically normal, or that has a normal chromosome number. You can't test all the genes, that's silly, but you can count chromosomes. So I would recommend several cycles of mini IVF to see if we can get better eggs. But I'm not going to make any promises because 45-year-old eggs will always have a low success rate. But if it doesn't succeed, then you can go to donor eggs. With donor eggs, you should have like a 95 or more % chance of having at least one baby. So donor eggs is an interesting subject. It sounds very, very spooky. But if you can't get pregnant with your own eggs, we've never had any unhappy cases with people that resorted to donor eggs. That's since 1986. We've never had an unhappy case. And that's because you can always match for a 20-year-old that has your appearance and background. That's easy to do. Many, many young women are ready to donate. And it's anonymous, so you don't know them, they don't know you. But there are 5 things you really care about in the baby. All women should care about this, all men. Personality, character, intelligence, emotional stability, and bonding with you as mother. But those 5 things are intangible and they're not in the DNA. I guarantee you they are not in the DNA. They arise very early in life from how you interact with the baby in the first 2 or 3 years of life. So all of our people that had to resort to donor eggs are happy. It's their baby. And sometimes I tease them. We get Christmas cards all the time, and I say, well, I know you're very proud of your child just graduating from medical school, but you realize it's not your DNA. And they laugh. They say, doctor, I don't care if it's my DNA. It's my baby. It's my baby in every way. So if you can't get pregnant with your own eggs, which is everybody's preference, then donor eggs is a good option. Certainly a secondary option, but a good option.